More and more Americans are either not filling their prescriptions or not taking their medications properly. This is a serious problem with lots of risks. Pharmacist Dorothy Wilkes joins us to explain those risks and offer tips to help solve the underlying reasons why people don't take their medication. Dorothy, thank you so much for being here.
Thanks for having me, Sasha.
So Dorothy, tell us, why is this such a big problem and how important is fixing it?
Medication non-adherence, when patients aren't taking medication in the way that it was prescribed, can be responsible for up to 125,000 deaths prematurely every year, in addition to the fact that we see about 50% of treatment failures as a result of this. So it's very substantial.
What about people with chronic conditions? How does this affect them?
Yes, for patients with chronic health conditions such as diabetes and hypertension, we know that they certainly are at increased risk for premature death, but they also have higher out-of-pocket costs as well.
You mentioned costs. Yeah, you're right. Medicine can be very expensive. So do you have any tips so people can save money on their medications?
Definitely. If you have insurance, speak with your plan. See if you can change pharmacies or possibly receive your prescriptions by mail. If you don't have insurance or have high out-of-pocket costs, consider a discount card such as InsideRx.com. They offer one that gives significant discounts for brand and generic medications for common conditions such as high blood pressure and diabetes. It's very simple to use and does not require any personal information.
What's the big takeaway for people diagnosed or living with a chronic condition?
Don't delay treatment. It's really important that when the doctor prescribes a medication that you start it right away, and if you have any hesitations or worries or questions, even simple ones, talk with your doctor or pharmacist. We're happy to help.